workstation. The doctors, the doctors have a similar workstation to this, where they'll go ahead and review it. The advantage to this is that you can have multiple doctors looking at your images at the same time. You can have orthopedic doctor, radiologist, ER doctor all looking at the same image. Once it's on the network, it's saved there, it's stored on a server, it's saved forever. So no more losing films and stuff like that as well. So, and they can further manipulate images if they need to do things like magnify the image or adjust the appearance of it as well. This is a CT scanner, so new CT scanner is dedicated to the ER. That way we can get our ER people scanned faster and not have to compete with outpatients and hospitalized patients that need scans as well, which we have another scanner in the radiology department to take care of them. If you have any questions about CT, I'll go ahead and try to answer that. Otherwise, you're welcome to go ahead and take a walk through the exam room. So, I don't know, did you guys get to hear any of that I was saying? Okay, good. So,
second CAT scan for the hospital is called a GE 16 slice unit, and what that means is that it takes multiple pictures. A single slice will take one picture, the 16 slice takes multiple pictures. The image detectors go around you, and the image quality is phenomenal. A CT scan versus an X-ray is designed to focus on soft tissue injuries. A lot of times our doctors will get a head CT after an accident, or somebody comes in maybe with stroke-like symptoms. They want to see if you have any type of blood clots in your brain, or any of your soft tissues are damaged, and that's what the CT scan is for. What's nice about having the second CT scan in the hospital is that in case ever any time that this needs maintenance, or the one down the hall needs maintenance, we always have a backup for the hospital, for the inpatients upstairs or the ER patients down here. What James has mentioned about the X-ray room across the hall, that's the first in the country that had FDA approval from GE. And what's exciting about that, you saw him pull that cassette out, where previously it was it'd be a fixed cassette with film in it, but now that cassette can go anywhere in the room and they can take an image. So picture, if you will, previously you'd come in on a wheelchair and maybe you sprained an ankle playing softball or doing something, that they're worried it maybe it's broken. Well, in the past, they would have had to get you up out of the wheelchair. You would have had to hop over to the table, get on the table, they would have had to put the cassette underneath you and take the image. Now they can take that cassette and actually put it down by your ankle. You never have to get up out of the wheelchair. And the image quality is much improved. So patient satisfaction, the focus on reducing pain. That's the first in the country. We've actually had now 16 site visits for other hospitals coming to see it, wanting to put it into their hospital. From as far as ways to Dubai, we also had one from Ireland over and look at it. So we're really proud of that, and GE, we're actually a show site for GE for that room. This is Kit.
Hi. Come on in, we'll go right on into the shower area.
No. We've now reached the shower
portion of your tour, yes. It's a group thing.
Grouping, huh?
Group shower. This is our decontamination shower area, where we have the ability to bring folks in from outside. That's an outside door there. And not risk contaminating staff or other patients in the department. And get them whatever material they may be contaminated with off of them so that we can treat them. That door goes directly into a treatment room there. It's all negative air pressure in these two and the two rooms down here, so we're not putting anything into the air system in the rest of the hospital. And it's a self-contained water system.
What would be a contaminant?
For us, for the most part, it's usually a farming accident, a chemical that is spilled. It can be someone cleaning their garage with a 30-year-old can of unlabeled something that's spilled and has made them ill. And if they still have it on their clothes, then we need to get them out of their clothes and clean before we can treat them. So we teach the staff at the front door, you know, that if somebody presents that way, then they escort them right back outside and we bring them around to the store and bring them in and get them clean. Because we don't want to risk ourselves or anyone else that can come in. So it is nice, it can be a family affair if needed. We try to be discreet. And the other end of this section is our 2 behavioral health rooms also, where we have the ability, in one of them has one-way glass where the police, if needed, can continually monitor somebody from outside the room. The nice feature about both of those rooms is that we can shut the room down and make it a shell with no equipment. All our rooms, the equipment's all at the head of the bed, on the wall, or in the drawers. These have doors that come down from ceiling to floor and close that all off. So the patient would have no access to anything where they could hurt themselves or others.
Interrogation.
Well, it's more somebody who's combative or altered or suicidal. So we can protect them by shutting access down to anything in that room. We protect ourselves sometimes in the same. Both of those rooms have access into those rooms from the ambulance bay foyer. So we don't even need to come into the department if we don't have to. So it's a very nice feature. The room next door with the one-way glass is where the police and paramedics have a work room, so they can do their reports after they come in. The one-way glass has shades that we can shut, so if somebody's in there we don't have to watch, we're not looking at them all the time. So it can be private. But I can't show you the nice feature because they're both full right now. They got patients in there.
Come on this way.
Yeah.
Chris is our end that works for our department, and she'll talk about the ambulance bay.
This is our ambulance bay. Garage doors open, and they're able to pull on in here. Holds 6 ambulances. Heat in the winter, air conditioned in the summer. Our old ER only we were able to have 2 ambulances. The calls ahead of time, and we'll be able to get your name, age, and chief complaint of the patient. We'll be able to designate a room ahead of time. There's a board behind Tim to the right-hand side that will say Beloit Fire Department or Remodel EMS. So they know when they unload the patient, they know which room they're in. We have 2 trauma rooms, rooms 4 and 5, so if need be, call ahead of time and we can clear that room or be ready for that room. We have flight and helicopter access, which is convenient and close by.
One thing that's nice to mention about UW and the MedFlight program and our relationship with the University of Wisconsin Hospitals is we've always been a clinical affiliate of UW Hospital since 1985, and they pulled down some specialists that allow us to provide specialty care to employees. We furthered that relationship just recently. We're very proud of this, and you should too as a member of our community, is that we were selected as the only resident site for UW emergency physicians. They did their physician training. Now they're doing their ER residency program. We're the only off-site facility that was selected in the state of Wisconsin because of the quality of care that we have and the qualifications of our emergency room physicians to train those residents. So on the weekends, you may see a resident here, and he's here to work with the emergency room physician to provide the care that's needed. We'll move it right into Zenith.